The video begins with the preparation for a surgical procedure. The patient is already on the operation table, and the team is ready to begin the process. The first and most important step before surgery is to establish an intravenous line. We started an 4-drip using Ringer lactate solution. The drip was started carefully to maintain the patient's fluid balance and to provide a route for the administration of medications throughout the procedure. Once the 4-line was running smoothly, it ensured that the patient remained hydrated and physiologically stable during the entire operation. After confirming that the 4-line was functional, the anesthesia team administered the required drugs according to the standard preoperative protocol. Each drug was given in the correct dose and sequence to maintain anesthesia depth and patient comfort. The anesthesia team continuously observed the patient's vital signs, including heart rate, blood pressure, and oxygen saturation, to make sure that the patient remained stable and adequately sedated. Once the anesthesia was effective, oxygen was provided through a face mask. The oxygen supply was connected properly, and the mask was fitted securely over the patient's nose and mouth. This ensured that the patient received continuous oxygenation during the induction phase. The oxygen flow was carefully adjusted to maintain proper oxygen saturation levels. The anesthetist kept close watch on the patient's chest movements and oxygen monitor readings to ensure adequate ventilation. After confirming that the patient was fully anesthetized, we proceeded with endotracheal intubation. The endotracheal tube, often referred to as ET2, was carefully passed through the oral cavity and advanced gently into the trachea. The intubation was performed smoothly, without any complications. Once the tube was in position, the placement was confirmed by observing bilateral chest expansion and checking for the presence of equal breath sounds. The closure process was started by approximating the deeper tissue layers with absorbable sutures. The muscle and fascia were closed carefully, ensuring good tension and alignment. After that, the subcutaneous tissue was brought together, followed by closure of the skin using non-absorbable sutures. Each stitch was placed neatly to promote proper healing and minimize scarring. After suturing, the area was again cleaned with povidone iodine, and a sterile dressing was applied over the incision site. The video concludes by emphasizing that the patient tolerated the procedure well. The mass was successfully identified and demonstrated. The airway management, scrubbing, draping, mobilization, and NG tube insertion were all completed as planned. The surgical steps were documented clearly for educational and clinical reference. The patient was stable at the end of the operation, and postoperative care was arranged to ensure full recovery. The entire procedure reflects proper surgical discipline and teamwork. From the initiation of the Ringer lactate drip to the administration of drugs, oxygen supply, intubation, scrubbing, toweling, mobilization of the abdomen, visualization of the mass, insertion of the NG tube, closure, and preparation for recovery. Each step was done professionally and systematically. Every team member played their role responsibly, ensuring the safety, sterility, and success of the surgery. This comprehensive demonstration serves as an example of how an operation should be conducted with attention to detail and patient safety. The focus remained on maintaining sterility, securing the airway, controlling bleeding, and achieving a successful outcome. Once the patient fully recovered from anesthesia, they would be shifted safely to the recovery ward for further observation and